We are delighted to have with us Dr. Prathap Reddy, Chairman Apollo Hospitals Group, and as many of us in healthcare know, the architect of modern healthcare. Dr. Reddy, we are delighted to have you. I just wanted to ask you, Dr. Reddy, where do you see Indian healthcare? Because you've seen the evolution, you've been the architect. Where do you see healthcare evolving in the next decade or so?
Anupam, I think it's a wonderful question that you asked. It is all of our wish saying that people across the world get the best healthcare. To get the best healthcare, previously we all said we need good doctors. Then we went to say we need good nurses. But what we are talking about is, you have realized now that hospitals just doesn't work on doctors and nurses only. If we have to do, the totality of care for patient, everybody is responsible. And whether it is a technologist, whether it's a nurse, whether it's a doctor, doctor's assistant, the managers, the processes are very much more now. We have passed through the phase. In the previous century, we had good doctors, so the good medicine took place. But today, the technology has played a very significant role in healthcare. But what we have is to jumpstart is the tools that are available through IT. When we use this and build this as processes and say that all of us at all time need to have that full commitment in the processes and care that we give to people, no stopping India. I think what we need to say is we will give the best care for our people and build the best systems for the rest of the world. Because we have started sometimes, if you have reached at that level, there are some legacies. Fortunately for us, this is how Apollo succeeded. Apollo succeeded when we started, when we never done an open heart surgery, when we never known what's infection control. From day one, we built those systems. At that level, what existed better than the best centers in the world, we took that. This is where I think using the IT, using the power of IT, we should be able to build those processes and give, the care which people will say, I'm glad I trusted this hospital. I'm glad I trusted this doctor. And this is what really means, because that is the time in life, because nobody expects that they're going to be sick. When that he's sick, he wants the best doctor in the world, best medicine in the world. Now I'm saying we need the best safety system and the best care for him. We are capable of doing it and we should do it.
Chairman, you've quite often said that if health is to reach everyone and it's everybody's right, we have to start thinking about health insurance, and you often give examples globally. So what do you feel? I mean, how many years do you think if we start now, would that dream of yours of making healthcare accessible to all actually become a reality?
I think somewhere along the line, insurance is not a new word for everybody, for most of the people. I know of people who buy for the two-wheeler, they buy an insurance. For their four-wheeler, they buy insurance. And I'm ashamed to say this, when they buy a home, they buy for theft, fire, insurance for their flat. But they don't buy insurance for their health of themselves or for their children or their parents. I think this thought process, they always know insurance is protection. But why don't you think that you need to protect yourself and your children who are dependent on you, who don't know anything about it? So why shouldn't we think of it? They should come automatically. A universal health insurance is what we are talking about. Bharat Swas is what we said about. I had it in my village. In my village, we insured everybody for 1 rupee a day. So whenever that surrounding village people could get an access into Apollo Hospital, Aragonda, and get excellent care. Why can't we do it nationally? Why can't we do it globally? Give this example for that other developing countries and the other countries who are looking at India can get this. You must understand that today, when President Obama made that statement, that they will not allow people going to India and Brazil, I am not hurt by it. On the other side, I feel pride that India now has gone saying suddenly India is going in competition, or they feel that India is a competition, because everybody went before 60s to UK, then they all went to US. Now I'm glad that they said, we will not allow our people to go to Brazil or India. So that is the level at which we have gone. So if we have developed the healthcare to that level. We need health coverage also for all our people. And there is facility. Government of India has given that, 15,000 rupees coverage. Use that. So you are really paying out of income tax tax benefits.
Dr. Reddy, you went to medical school in a very different environment. What would you like to say to some of the young people who are now getting into medical school, because medicine is so different, the expectations of the patients is so different, technology plays such a role. So how should some of the young people prepare themselves for a career in medicine, and that would be some advice coming from you?
I think it's good. I think all of us must remember, during transition of time, many things happen. Like in everything else in life, there has been a knowledge revolution, technological revolution. Today, the IT has made a significant impact. So the present students must now say, hey, I have something which my parents did not have or my predecessors did not have. So I'm going to take this and then make a quantum leap in the healthcare delivery. But you should not forget, like in everything else, that importance of care, commitment is very important. In healthcare, it's much more. All my advice for them is, use all these tools that we have in jump-starting the learning processes and all of this. With simulation, you can straight away go and do a neurosurgery. With simulation, you probably can do even a heart transplant. But what is needed is your own personal commitment and the love for what you're doing.